Then for the bacteria, we have H. pylori, that is mostly known to cause the gastric cancer. When you are exposing your body each and every day to this deep fried food, it can now stimulate these normal cells to start now multiplying abnormally because of the carcinogens. So maybe if that craving is there, you can just do your boiling. Instead of deep frying, I will emphasize you can do shallow frying. Maybe the farmers maybe sprayed the cabbage with the chemicals. Then he realized in the following day the market is ripe. You see, now this farmer won't wait for that chemical to so what happens is that they will harvest and they bring this cabbage to us. At the end of the day, we will consume them without any knowledge. So you get the mode of practice, with us, the Marians. It's one of the leading causes of these high numbers in cancer.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air, friends and guests.
Hello everyone. It feels so good to be here, sharing space and energy with you. However, we cannot continue living as a society, denying the facts that are around us. Cancer is a monster that is here, and as much as we are doing everything possible to contain it, it's eating our people every day. And trickling down as a county, that is Meru County, we are second in the country. And this being the fact, just because it hasn't affected you yet, if you look around, you hear of someone that has cancer around you. That tells you that we need to be aware of the facts. We need to be aware of what to do in case we have someone that has cancer. And today we have Victor Kitije, a nutritionist at Grace Park Medical Center, will be telling us more about the meals of a cancer patient and the nutrition, what to look out for, because definitely for the patient, it's not business as usual. Welcome, Sana, to the show.
Thank you, Shiko.
Yes, I hope I got the name right.
Yeah, my name is Victor Kitije. I'm a clinical nutritionist officer working at Grace Park Medical Center.
So, of course, we cannot get into discussing cancer without really defining what it is. So, what is cancer?
Basically, cancer, it's a group of diseases that involve abnormal division of the body cells with the potential to invade or to spread to other part of the body.
And what causes these abnormal cells?
Basically, what we normally terms as the main causes of the abnormal cancerous cells, we have what we call different types of carcinogens. And these carcinogens, they are the ones that normally causes the transformation of the normal body cells to the cancerous hammer malignant cells.
And now these carcinogens, leo nile day. If you could go deeper, I know for the layman who is watching, because of course we are not, or we don't all have this knowledge, and we are really trying to spread the knowledge and for people to really understand what cancer is. Because we also have, people who believe as Christians, we want to believe everything imeletwa na shetani, but we really have to get our facts right.
So for these carcinogens, they are classified. We have the chemical carcinogens, we have the biological carcinogens, and we have the physical carcinogens. For the chemical carcinogens, These are the things like metals like asbestos, things like tobacco smoking,
Yeah.
things like alcohol,
Mm-hmm.
aflatoxins.
Mm-hmm.
The people normally store their maize in the granary.
Yeah.
It normally tends to have those aflatoxins,
Mm-hmm.
like then for the biological carcinogens, now these are the things to involve virus,
Yeah.
to do with the bacteria and parasite. When you come to virus, we have two viruses that are known to cause the cancer. That is the HPV virus.
Yeah.
We have hepatitis B and C. They are normally known to cause these malignant cells. Sorry. Then for the bacteria, we have H. pylori.
Yeah.
That is mostly known to cause the gastric cancer. Then for the physical carcinogens, we have things like UV radiation and the things like X-ray radiations. So the interplay of these carcinogens and the genetics, they are normally the ones that now causes this transformation of the normal blood cells to the abnormal cancerous cells. Yeah. And then mostly for the carcinogens, maybe for the layman, for the maybe better understanding, we normally say that the mode of preparation of our food, it normally plays a major role in terms of these carcinogens. Because we normally say when you expose that is to do with meat, maybe poultry or fish, into a very high temperature, you normally provoke what we call the amino acids and the creatinine in that meat to form now the carcinogens. Okay. So it can maybe through the meat being exposed to the high temperature. The method of preparation matters a lot. Yeah.
So, of course, with the career and all that, taking as mbio mbio, we want to get home, put the chicken on high, eat, tunapika mbio mbio tukienda. So you're saying these could be hand in hands. Yeah. And so what are the recommended, like, how can we tell the people how are they supposed to prepare these meals? Because now, people are finding it when you go down into especially social media, and you try to look at what to eat, what not to eat, especially when it comes to cancer. You might as well just starve, because you're told every day there's someone who makes a video says don't eat it, don't eat that. So what should you say? How would you generalize it? How should we take better care of ourselves, but people that are not infected yet?
So what we normally advise our patient, maybe when you are doing the preparation of your, maybe it is lunch, it is your dinner, take your time. Okay, have a list of what you want to prepare for that lunch or your dinner. Let me see, maybe you want to take your rice with a stew, maybe a chicken stew. So you can, for the chicken, instead of doing the deep frying, because remember that when you're doing the deep frying, you are exposing this meat into high chances of these carcinogens. Okay. Because what happens with the fat or the cooking oil that you're doing, it normally gets hydrogenated. Okay. So we normally advise our patient if they can do boiling or if they can do shallow frying. Okay. Instead of doing the deep frying, okay, or the grilling, broiling, they can just do boiling or just do shallow frying.
Now, of course, that's something that we will really get in trouble with. People really love our fried chicken. What if one pre-boils it, then deep fries? There are those times you're really craving that.
Now with the exposure, the times that we are living right now, people have a lot of craving in the things that have a lot of cooking well, the things that are exposed to high temperature heat. And these are the things now we are educating our people to have that knowledge, to know that when you are exposing your body each and every day to this deep fried food, it can now stimulate these normal cells to start now multiplying abnormally because of the carcinogens. So maybe if that craving is there, you can just do your boiling. Instead of deep frying, I will emphasize you can do shallow frying. Yeah.
So machipo chipo pale, what happens?
Especially now when it comes to cancer patients, even the food that they are told to actually avoid. In the list of the food that we normally advise them, basically we have foods that we normally tell them to put them aside. Okay? Number one being the highly processed carbohydrates or the highly processed food items. Okay, that is number one. Number two, they advise to avoid food with the deep fried food. Whatever we have discussed earlier, the deep fried food. If it is to do with meat, they try to avoid the chomas, because now remember that when we are doing these chomas, there is a combination of that smoke again with your meat. Now predisposing this meat to carcinogens again, which now will make the malignant cells to multiply more or spread more.
But now, you're saying, especially now with the choma, of course, it's the mixture of the smoke and all that. We keep believing that now, we're doing things in a fancy way. We are putting the foil, and we think we're protecting ourselves, because if you read more, they keep telling us about the charness on the meat. That is the blackness on the meat is the wrong thing. What if now you're using the foil and all that? Because nyama choma and Kenyans kidogo.
So what we normally advise our patient, even for us who are healthy, for the meat especially, they are termed to cause the colorectal cancer. That is the colon and the rectum cancer. So for the meat, what you can do, if really you can take at least at around 100 grams to 130 grams twice per week, you're good to go. You are not supposed to, you see some people, they want to take half a kilo, 1 kilo, so that they can feel satisfied. But from our head as a clinical nutritionist, we normally advise, if in a week you can have 100 to 130 grams twice per week, that is healthy. Okay. Then now for the chomas, you see now this meat, it depends even from the animal itself. Let's say this animal was fed from a chemical grass, then it comes all the way to now the time that it is being roasted. Again, now there is that mixture of that smoke, exposure to high heat. Now that is where the risk it is.
And especially the fact that really if you're eating in these joints, you can tell where the meat comes from. So now, would you say it's because of the deep frying and all these methods that we have today that are making these statistics go higher? And like back in the day, our grandparents, if cancer was there, it was minimal, yani ni mtu moja moja here and there. What are we doing different apart from this? What else are we doing different? Because you get into, again, we'll keep on saying social media, because that is where the world has moved to. Of course, you keep on saying the microwave, the fridges. Would you say that has anything to do with it?
So you see, whatever we normally discuss a lot is the predisposing factors of the cancer. Number one, we have what you call the hinge. Okay.
Yeah.
Like now, it is of concern when a man is of hinge that 5 and above, they have to do screening for the prostate.
Yeah.
Okay. When maybe for the ladies, when we have maybe late menopause, again you need to do the screening for the breast cancers. Okay. So age is a factor.
Yeah.
Number two, we have the diet, the type of the diet people are taking. Right now, like in Meru, the way you said about the Meru County, we are actually the second leading county with cancer cases. And this is majorly because of the exposure that people are living with each and every day. You get like the mode of preparations. If you go to that butcherman, they tend to preserve their meat with chemicals.
Yeah.
And with the innocent Kenyans, we are going to buy those meat without any knowledge.
Yeah.
If you go to fruit vendors, no one can keep quiet to see maybe his or her fruit are going
bad.
going bad. So they normally also do preservations with the chemicals. So you get at the end of the day, the consumption of the chemicals around us is very high. If you go to do with maybe region from like Igembe, maybe Igembe South, the production of their cash crop, that is Mira, you get there is a lot of use of chemicals to spray those Miras for the market. So you get these people, at the end of the day, they will consume these chemicals from this Mira, and they will end up having the esophageal cancers, throat, all the way to do with gastric cancers. Okay. When you go up here to do with this region, Kibiritia, where we normally get our cabbage from. Okay. You see, those cabbage are very, when you look at them, you
very
normally,
attractive.
very attractive. So what happens is that maybe the farmers maybe sprayed the cabbage with the chemicals. Then he realized in the following day the market is ripe. You see, now this farmer won't wait for that chemical to So what happens is that they will harvest and they bring this cabbage to us. At the end of the day, we will consume them without any knowledge. So you get the mode of practice, okay, with us, the Marians. It's one of the leading causes of these high numbers in cancer. Number two, lack of earlier screening, because again you get majority of the patient, they normally present in the facility at stage 3, stage 4 of their cancers. And you see now with the stage 3, stage 4, even the quality of treatment and the turnaround, it's actually on the lower percentage compared with the patient who will be discovered at the early stage, stage 1, stage 2. And you will see together with the medication and whatever will be done, the quality of life, the quality of improvement will be achieved. Okay? So I think it is a public health concern to do with our county. I think the public health institution in our county, they need to do their job. Because they need to know why, like a certain region, we have high numbers of maybe brain tumors. Why in certain region we have high numbers to do with colorectal cancers. Then they come up with statistics, they come up with information that maybe can help our people in the county.
So there's something we didn't quite touch on, especially the microwave is very controversial when it comes to cancer. Would you say, do we use it? Do we not use it? It's something that really doesn't come out clear.
So I know with microwave, we have a lot of myths going around it.
Yes, about it, yeah.
People normally say when you consume food from the microwave, it will lead you to cancer. But actually, the mechanism and the function of the microwave, it doesn't affect the food inside the microwave. What happens, we now the individuals, when you are warming or when you are using that microwave, you are recommended to stay at least 2 meters away from it. Yeah.
Okay, as we want to watch as our food is.
You have to stay 2 meters away from it. But inside, whatever is happening to the food, it doesn't have any harm to us.
Okay.
So the other thing people normally say about the radio wavelength of our phones, because at times the people who normally sleep with their phones, which also is a risk.
Guilty. Under the pillow.
Under the pillow or there. Yeah. So what happens is that those wavelengths, they are not health to your body. Especially they can harm your brain cells, and actually they are not good. When you're sleeping, make sure your phone is at least away from you. We are not supposed to sleep with our phones.
There's something that you mentioned earlier about H. pylori. I know that is something that will really catch almost everyone's ear, because nowadays you hear someone that has a stomach problem, kidogo, go get tested, H. pylori. Does it mean just because you've gotten the prognosis of H. pylori, now you're automatically getting cancer?
Not really. Actually, what we normally see, 60% of the gastric cancers, they are normally caused by these H. pylori bacteria. Okay, so that's why when maybe you are diagnosed with these bacteria, you are normally advised to take your medication well, to take your diet well, because we do not want these bacteria to recur. Because now the effect occurs, you are just treated, after 2 weeks you come back, you have the same complications. So you are exposing the stomach mucosa lining into maybe ulcers. You normally hear these terms that somebody has a stomach ulcers. So with the recurrent of these H. pylori bacteria, the stomach ulcers, it can blend and cause these gastric cancer. So that's why you advise, when not only even to do with the H. pylori, even if you have issues to do with emptying your bowels, that is, maybe you have several days with bloating, constipation, having stool with blood, okay, it might be a sign of something in your GIT system. That we normally advise that you can go for that screening. Because it might be something that is coming up that can predispose you to these malignant cells, cancerous cells.
Now, this person now has been diagnosed with cancer. Of course, we are saying the main topic now is nutrition of this patient that has cancer. What has to change from now the diagnosis table? What has to change for this person?
No, maybe when this when you are told, when the news are
is broken,
some of the patients, they are even shocked, terrified, because now once you are told you have a cancer, some patient normally thinks it is a life sentence. And that's why in each and every facility, I think they normally have multidisciplinary. That is, once you are told you have cancer, you normally have in support to do with a psychologist, counselor. Everybody is involved. You have to be taken step by step. Okay.
Healing hands are strong. the heart of Middletown. Grace Park lights the way, bringing
Hello
hope
guys,
to
my name is Kenfrey. So many of you have been asking us about our services under SHA. So at Grace Park we accept SHA for inpatient services, maternity, surgical services, oncology, and dialysis services. So however, for maternity services, one has to do some top up. For normal delivery, one will top up 3,450 shillings. This will cater for the outpatient test, since at the moment, SHA does not cater for outpatient services at Grace Park. For CS, the top up will be 5,450. The cash top up goes towards the outpatient tests, which are for normal delivery. We have the blood test, commonly referred to as the CBCs, the HIV test, and our super admission kit. So if you're not familiar with our admission kit, please go to our TikTok page and you'll find a video there that is explaining the contents of our admission kit. For the CS, the top up that we've said is 5,450 shillings. Will cater for the CBC test, the HIV test, and the renal function test, otherwise known as the kidney function test, and also the admission kits. For any other query about our services under SHA, please do not hesitate to call us on the numbers below, and you can also get in touch via our social media pages. Thank you.
Grace Park lights the way, bringing hope to 2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air.
Because at the end of the day, you have to understand. If you're told right now you have a breast cancer, you have to understand what is breast cancer, what are the mode of treatment, okay? Because some, let me say, maybe to do with the breast cancer, some they normally, if now it is a small lump, they can undergo a surgery. That lump is removed. You have to be informed about that. Okay. If now it is to involve the whole breast, maybe the whole part of the breast will be removed. Okay, through surgery. You will undergo maybe chemotherapy. Then maybe there you will maybe do your radiotherapy. Okay. So you see, this process, you have to be informed and understand, because at the end of the day, if you don't inform your patient, you will have issues. Okay. And some will default even from the treatment.
Exactly.
Yeah.
And now, you've said, of course, the surgical way, of course, now depending on the depending on the cancer that you have. Now, what are the others? We hear of chemotherapy, we hear of the radiotherapy. Do you guys offer them here at Grace Park? And what exactly is chemotherapy? If you could distinguish it for us just a little bit.
Yeah, so for us here at Grace Park, we are offering those services. We have our active oncology department with all the team, that is nutritionist, pharmacist oncology, nurse oncologist. We have the specialist clinic oncologist. We have our counselors. Yeah, so for us here, we normally offer the chemotherapy. Okay, we normally offer the chemotherapy, and for the chemotherapy, it can be through the intravenous way, or it can be through the orally. Okay, they are medication that you are given to mitigate the invasion of these cancer cells, or to prevent them from spreading to other part of the body. Yeah.
And then definitely with all these mode of treatments, there are side effects.
Yeah.
We hear of mouth sores and there's nausea and there's all that. So how do you help this patient now to be able to curb some of these side effects?
So to do with the treatment, majorly the patient normally present with this side effect. It can be constipation, it can be diarrhea, it can be nausea,
Yeah.
it can be metallic taste, it
Yes.
can be sores in the mouth. So we normally base it, like for me, when I'm taking my patient through the diet, I normally base it to specific patient according to the side effect that they normally present with. Like if someone present with constipation, okay, it might be due to the treatment itself. At times, the side effect of medication that are given to maybe for the pain medication,
Yeah.
some are given the opioids, others are given antiemetic treatment, and some of these pain medication they can cause the constipation.
Yeah.
Maybe your patient, the hydration status is not adequate. Some patient maybe they may forget to take plenty of fluids, that is water. They can present with dehydration. Some patient they normally don't take fiber, adequate dietary fiber. And now you get that all these can lead to this constipation. And once they present with that one, we normally advise on the intake of adequate fluids. It can be maybe be water, it can be juices, it can be soap, anything that you can drink orally.
Yeah.
Then I normally advise also on the intake of high dietary fiber, because you find these dietary fiber, especially the soluble dietary fiber.
Yeah.
It normally helps during the formation of the stool, the bowel movement. It
Yeah.
normally help in that all that process. Yeah. Then the other patient, they might be physically inactive, okay, or immobile.
Yeah.
So you get that this patient, because maybe of the treatment, they are not able to do any activity. So you get once maybe you are not active, your bowels tends to less function like somebody who is very active.
Yeah. Yeah.
So we also advise them on the kind of the exercise they can do while they are at their home. Yeah.
I know you mentioned that, especially now with cancer patients, you really discourage deep fried foods.
Yeah.
What other foods maybe do they stay away from?
Majorly, it's apart from the deep fried food, we normally now see these the sugary and sugar food items.
Yeah.
Because again, remember that these cancer cells, they normally feed from these sugars that we're giving to our body. And that's why we have different type of sugar. Like when you take cups, the sugar that you normally get there, it's what we call glucose. When you take fruit, the sugar that we get there is fructose. When you take milk, the sugar that we get there is lactose. And now we have this refined sugar that we normally add to our tea,
Yeah.
to our porridge. We normally discourage on those processed sugars, the processed carbohydrate, the processed food, okay, and the canned food. You see, now we are in an exposure that we can access this food from
Yes.
our supermarket.
Yeah.
We also discourage that. And majorly the food that we normally advise them now to take, because now you see with this cancer, it normally alters your health in totality, because now of the side effect, because now of the side effect that comes up with the treatment. It can maybe the diarrhea, as we have spoken, the constipation, vomiting. So you find that this patient, we normally advise them according to the presentation of
Yeah.
the side effects that they have. Basically, even for us who are healthy, you are normally advised to take a healthy meal. That it touches to do with healthy protein, healthy fats, vitamins and minerals, healthy carbs. And when it comes to do with the protein for my cancer patient, I normally advise them on plant-based protein because they are normally rich in, they are very high rich in vitamins and minerals. Okay. When it comes to do with fat, I normally advise them to take healthy fat, that is to do with monosaturated and polysaturated fat. And especially this fat, you can get them from the avocados, olive oil. Okay. And these mono and polyunsaturated fat, they normally provide the body with essential fatty acids, that's the omega-3 fatty acids, which normally help this patient to combat the inflammations. Okay.
Yeah.
When it comes to do with carbs, I normally advise them to do with actually when they are choosing these carbohydrate, they're supposed to minimize the choice on the processed carbohydrate. So we normally advise them on the whole grain, okay, the oats, okay, the whole wheat. They are supposed to avoid the white bread.
Yeah.
Okay,
Yeah.
these processed carbohydrate. Okay, and you find the carbs with the whole grains carbs, they have the soluble fibers again, which normally helps in production of short chain fatty acids.
Yeah.
Okay.
Yeah.
When now it comes to do with the vitamins and the minerals, we normally advise them to do basically they can check the labels on whatever they are taking. They can check if whatever the food items they are doing is fortified. Okay, because now these vitamin and minerals, it's the ones that help the body in the enzymatic process, which normally helps in the good immune function of the body, and again it normally helps to combat this inflammation.
Yeah.
Yeah.
Now, of course, you've mentioned the different classes of food.
Yeah.
You've given examples, especially when it comes to the fats. You've given avocados as
Yeah.
an example.
Yeah.
So, when it comes to the healthy carbs, perhaps you could give us some of the examples there, and even the plant-based proteins that you recommend to your patients.
To go back to the carbs, the healthy carbs to take, we normally terms them like the carbs that are not processed.
Yeah.
And majorly, these are the things that we normally take in each and every day. Things to do with ugali. We normally take the processed ugali, the flour. And remember that the production, the manufacturing process of this flour, there is a point it normally passes through chlorine gas to whiten it. Okay.
Yeah.
And remember that any chemicals that is used for the preservation or to manufacture, again, remember we talk about chemical carcinogens.
Yes.
Okay. So if it is to do with ugali, you can just have your fresh maize. You can take them to posho mill. Then you take that ugali. It's very sweet. It normally help in the when it moves around in the gut. It normally takes a lot in that gut because it is coarse. At times you feel something is going down.
Yeah.
For real.
Yeah.
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 The other thing is to do with these indigenous food items like cassavas, yams, domangwashi. If the mode of farming is well checked. If there is no use of chemicals to farm these ngwashi or oduma, they're good to take.
Yeah.
When it comes to do with things to do with bananas, you can do your mukimo nicely and you can take it. Yeah. If it is to do with the wheat, you can do the whole wheat rather than these are the processed wheat flour.
Yeah. Fruits.
For the fruits, basically all the fruits are okay for our patient because we normally advise them to take plenty of fruit.
Yeah.
Remember again, these fruit are the one that gives our body the vitamins and the minerals. Okay. So you get that now my concern with the fruit is mode of preservation. Sorry.
Yes.
Because again, the market is not good for us. People outside there, they are after our maybe money.
Yeah.
They are not asking themselves, what if this fruit I preserve them with this chemical and bring something that is of public health concern? They don't normally ask themselves those questions. So if you can get a fresh fruit, maybe from your kitchen garden, from your garden, from your kashamba, that's okay.
Yeah.
Any fruit. But unless now maybe you have hyperacidity, or maybe you have a gastric cancer or esophageal cancer,
Yeah.
normally now counsel you maybe to put aside the citrus fruit because
Yeah.
again of the acidity.
Yeah.
Yeah.
Now, of course, we know that there are stages of cancer. Like you even said that one of the other issues that we are facing is the fact that we are not going for screening and we are presenting ourselves to facilities where we are almost, stage 3, stage 4. Stage 4 is the last one.
Yeah, stage 4 is the last in the stages. We have that is stage 1, stage 2, stage 3, stage 4.
Yeah. So, if you could describe this patient that is at stage 4, assuming this is a patient that is so frail, even perhaps eating is a problem.
Yeah.
We also mentioned that some of these side effects are, of course, mouth sores, and that means this person, maybe even swallowing is a problem. So, what happens to this patient and their nutritional? How do they get the nutritional value that they need?
Yeah. So for these terminally healed patient, maybe the patient who are in stage 4, these are the patients that are very delicate. We normally offer a holistic treatment because again, remember that these patients at times they get emotional, they get irritated. Okay. Now, if we have a patient, maybe the GIT is not functioning normally.
What's a GIT?
The GIT is
Yeah.
this system, the food system that is to do from mouth all the way to the anus. Okay,
Yeah.
that is to do with the mouth, the esophageal, the stomach, the small, the large intestine, and the rectum.
Yeah. Now we told you we pride ourselves of being a program that really wants to educate that person. We don't want to give them some terminologies and not end up getting there.
So we have a various method of nutrition. That is, we have what we normally term as total parental nutrition. If now this when we eat normally, the food normally gets into our stomach, it's digested, and the body absorbs the nutrient. Now, if there is the alteration of that process, maybe you have a gastric cancer, okay? Before when we go to the total parental nutrition, mostly of our surgeons, they normally recommend we can bypass that stomach. We have what you call jejunostomy. You get a tube direct to your small intestine. Then we modify, we enrich and fortify blended food, kitchen food. Then we push it through that tube. It gets direct to the
Yeah.
to the body. But now we normally look at what is the function of the small intestine. Majorly there are some food, maybe like protein,
Yeah.
that is digested in the stomach, that won't have major value when it is pushed direct to the
Direct.
small
Yeah.
intestine.
Yeah. Yeah.
Maybe a patient has a esophageal or the throat cancer, or the esophagus cancer. Now you get this patient maybe cannot be able to swallow. We normally have what you call peg tube, or you can have a tube direct to your stomach that also help us to feed you through these kitchen blended fortified food direct to your stomach. There are some now who maybe the whole part of the stomach or maybe the major part of the small intestine is cut. So you normally find that this patient again, they have to survive. You can put them to total parenteral nutrition. And for the parenteral nutrition, we have we have the peripheral, and we have the one that normally goes through the central venous. Okay, and these are the last molecules of food. You see, when you digest, you heat carbohydrate, it is digested to produce glucose. Now this TPN is packaged with this glucose to go direct to your bloodstream. Okay, so for the patient maybe who are very weak, they have undergone the chemo, the radio, they are very weak. They can't even be able to eat anything orally. Maybe they have that esophageal, the gastric cancer. We normally prescribe for them the TPN fins, whereby it can be either through the central venous catheter or through the peripheral. Okay, and you find that these TPN fins, they normally do wonders, because you normally get patient is very weak, they have electrolyte balance, they can't maybe even they are bedridden. Once you introduce these fins within the 48-72 hours, you normally get these patients are able to move their limbs, they are able to communicate to their relatives, and which is very that act normally give even the relatives hope that our patient is now recovering. Yeah.
So now, what do you feel are the most common mistakes that are made, especially by caregivers, when it comes to patients, cancer patients, and their nutrition value?
So you see, when it comes to caregivers, at times when someone is diagnosed with the cancer, it is something that needs even the support from the relative and the family. And now you get some people tend to run away from you. Okay. So you get, they don't have those information. You get, you have a patient who is terminally healed with these cancer concerns. You get maybe a relative is maybe carrying let me see something like a sonda for this patient. What are you doing to this patient? Are you helping? Does this have any nutritional value to this patient? Okay. So what happens is that what I normally advise my patient is that it is something that is complete. I need to have you as my patient and your relative. It can be your spouse, it can be your children, so that we can have that talk together. Because again, now you see, now with the cancer, it also involve a lot of concern to do with money, because maybe you have a concern to do with digestion. You are not able to digest whatever you are given orally. Then maybe I prescribe for you an enterofins. Okay, this is to involve for the relative to purchase for it. Now it needs a multidisciplinary, not only for the patient, even for the relative to have this information with them. Yeah.
Yeah, Victor, we are so super grateful. I know cancer is such a broad topic. We could be here the whole day. We'll definitely come back and try to broaden this topic. Maybe one last question. You mentioned that Grace Park, you have a clinic for this. Is it that you have particular days for it, or you take walk-ins for now when it comes to cancer patients?
Currently, we are open. That is Monday to Friday.
Yeah.
Any day when we have any patient that has any concerns, they are welcome to our facility. They are handled well.
Yeah.
We have for the team. We have the pre-authorization team that normally facilitate them to do with their SHA, the insurances. Okay.
Yeah.
Then we have the lab team whenever they want any lab to be done to them. So any day of the week,
They can come in.
They can come in.
Screening?
For the screening, when it comes to do with the screening, also it is done any day of the week.
Any day of the week.
For our ladies, they are most welcome any day. We normally offer the cervical cancer screening, anything to do with ladies. Actually, I will propose one of these days we have a healthy woman clinic. Maybe to have them that day, get screened, whatever they feel they want to ask, they ask.
They can ask.
Yeah.
Victor, asante sana, even for finding the time in your busy schedule to come in and share this knowledge with us, which is very important.
Yeah, sure.
May also God keep on strengthening you as you work and as you also uplift our society and the patients that are already affected by cancer. Asante sana.
Thank you.
Thank you so much, guys, for staying tuned to this episode. I'm sure you've gotten one or two things about cancer. Really, cancer is not a topic that we can say is boring us. It's a topic, it's a thing that we really have to keep on talking about. We can never really have enough of it because every day it's becoming more aggressive. And just as it's becoming aggressive, we have to be even more vigilant to curb it. Thank you so much for always being here, for supporting X Living. Let us know what you'd love to see more of, even in the health sector or even in other topics. Which guest would you love us to bring? Which guest would you love to see next? Thank you so much. Let's keep subscribing, liking, commenting, sharing with your friends. Asanteni sana. May God bless you. Until next week. Bye-bye.
Healing hands are strong in the heart of Middletown. Grace Park lights the way, bringing
Hello guys, my name is Kenfrey. So many of you have been asking us about our services under SHA. So at Grace Park we accept SHA for inpatient services, maternity, surgical services, oncology, and dialysis services. So however, for maternity services, one has to do some top up. For normal delivery, one will top up 3,450 shillings. This will cater for the outpatient tests, since at the moment, SHA does not cater for outpatient services at Grace Park. For CS, the top-up will be 5,450. The cash top-up goes towards the outpatient tests, which are, for normal delivery, we have the blood test, commonly referred to as the CBCs, the HIV test, and our super admission kit. So if you're not familiar with our admission kit, please go to our TikTok page and you'll find a video there that is explaining the contents of our admission kit. For the CS, the top up that we've said is 5,450 shillings. Will cater for the CBC test, the HIV test, and the renal function test, otherwise known as the kidney function test. and also the admission kits. For any other query about our services under SHA, please do not hesitate to call us on the numbers below, and you can also get in touch via our social media pages. Thank you.
Grace Park lights the way, bringing hope. Two peaks living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, exciting.